Medical Dialogue's daily dose of health and medical news. I am Dr. Nandita, and let us review some of the latest developments in the medical world. Radiologist fined compensation on showing wrong report. Radioactive iodine for hyperthyroidism has minimal cancer risk, study confirms. 15 Delhi government schools to get health clinics by October. Omega-3 and vitamin D supplements found to improve mental health in women with pre-diabetes. Eye conditions linked to heightened risk of dementia. A new diagnostic tool for diagnosis of pseudokaposi sarcoma. Menstrual changes reported after COVID-19 vaccination need further investigation. Kids' fever cases giving states the shivers. Vitamin D not found beneficial for child neurodevelopment. Pfizer COVID booster doses only for people 65 years and older. Wrong diagnosis given by the hospital and radiologist. The patient had to take multiple opinions. The District Consumer Commission Firozpur has directed them to pay the complainant Rs 70,000 as compensation. President of the commission Amardeep Singh Shergill asked them to pay Rs 20,000 for the amount the complainant had to pay for getting second opinions and Rs 50,000 for mental harassment and agony that the patient suffered due to wrong report which showed anterior cruciate ligament tear and mild joint effusion. As the hospital was insured under the doctor's indemnity policy, this amount will be taken from the insurance company. Cancer, as we all know it, is a deadly form of disease. Treatments have been varied, including chemotherapy, radiotherapy, and immunotherapy. With the advances in this field, it has been found out that insignificant risk of cancer is linked with low doses of radioactive iodine treatment, especially in patients with hyperthyroidism. The study included participants treated for hyperthyroidism with this therapy and followed up until cancer diagnosis or death. The primary outcomes were cancer incidence and mortality for exposure versus non-exposure to radioactive iodine treatment. The results showed no elevations in risk for cancers except for thyroid cancer incidence and mortality. Therefore, it was concluded that this therapy for hyperthyroidism is small. 15 Delhi government schools will soon have school health clinics where children will be provided with physical and mental health services. With the schools reopening gradually, the government is hoping to inaugurate the clinics on 1st October. The setting up of the school health clinics was announced by the government in 2018. Now, as a pilot project, they have been started in 15 schools located in various districts of the city. Diabetes has become one of the most common non-communicable diseases in the recent years. According to a WHO report, 422 million people have been affected worldwide in 2014, which is triple the amount affected in 1980. However, a recent study shows vitamin D and omega-3 co-supplementation can be recommended for women with pre-diabetes and hypervitaminosis D. The study included women with this condition who were assigned to 4 groups for 8 weeks. The study results showed that in terms of reduction in anxiety and improvement in sleep quality, the researchers observed a significant difference in the co-supplementation compared to the other 3 groups. Also, there was significant difference between the groups receiving both supplements and the group receiving only placebos in terms of reduction in depression and stress. The researchers then concluded that concurrent intake of vitamin D and omega-3 improved depression, anxiety, and sleep quality in such women. Therefore, this therapy can be recommended for improving mental health in this group of people. Vision impairment can be one of the first signs of dementia, and reduced stimulation of visual sensory pathways is believed to accelerate its progression. Age-related macular degeneration, cataract, and diabetes-related eye diseases are linked to an increased risk of dementia, suggests a research published online in the British Journal of Ophthalmology. Compared with people who did not have ophthalmic conditions, at the start of the study, the risk of dementia was observed in 26% was higher in those with age-related macular degeneration, 11% higher in those with cataract, and 61% higher in those with diabetes-related eye diseases. The study concluded that age-related macular degeneration, cataract, and diabetes-related eye disease but not glaucoma are associated with an increased risk of obtaining dementia. Individuals with both ophthalmic as well as systemic conditions are at a higher risk of dementia compared with those with an ophthalmic or systemic condition alone.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.